Hello guys, my name is Argya Chatterjee. My day job is a banker, but I have a lot of interest when it comes to playing football and badminton. As you can see that I am not really great right now, but a couple of days ago I was very fit. But I was having breathlessness. But I thought that could be avoided and I did not come up for a proper treatment. As fate has it, my mother was being admitted to the hospital for some other reason, and one of the doctors noticed that I was breathless.
For a 24-year-old football player and a mountain climber, he was not able to climb even 2 ramp-up stairs. கொஞ்சம் ஆக்சிஜன் லெவல்லாம் குறைய ஆரம்பிச்சது. Since that happened, we advised let's further evaluate, and when we did the CT, we found there was a huge air locked in inside his right chest, right part of the lung, and it is pressing on his heart and it's creating a tension and not allowing him to breathe.
So he was in the ICU for 4 days. He had to be ventilated the first day. The second day we tried something else. We tried double ventilation, and slowly but surely the lungs became better, and he was out of the ICU in around 4 or 5 days, I'm not sure.
But that was taken care of very, very briskly. The staff here were very determined in order to get it sorted out, and they planned a very proper course of treatment. The treatment involved a lot of things which I am not really fond of, or which I am not really proficient in, but it involved a couple of ventilators. They first placed one of my right lung under ventilator in order to reduce the edema. This is what I am understanding. I am not really sure of it, but that did not help our workout.
இது அவங்க ஃபேமிலிக்கு கவுன்சில் பண்ணோம். They accepted the risk, and then we placed an ICD. And the spillover of fluid, when the lung expanded, it sucked in fluid from the blood vessel, and the amount of fluid that entered his lung did not allow him to maintain a safe oxygen level. So initially oxygen step up panno, he didn't respond. It was very florid, and then we went ahead and intubated him. Even after intubation, the problem is in the right side of the lung. The left side of his lung is normal, but the fluid that is seeping out from the right side is preventing the left side from functioning normally. So we couldn't ensure safe oxygen levels for him. So we isolated both the lungs and used something called as differential lung ventilation.
So the proficient doctor decided that it is better to put each of my lung under a ventilator. This actually helped me a lot in the long run, because within 24 hours I was on my way to recovery. After 24 hours on both the ventilators, my sinus rhythm were matching off, and they took one ventilator away. Another 24 hours had elapsed, and they decided to take the second ventilator away as well.
Another one side of the lung is diseased, infected, and is not able to work. It needs a different way of ventilation, whereas the other side of the lung, the left side of the lung, is normally working. It needs a different ventilation. ரெண்டுமே ஒரே டைமில் ஒரே ப்ரெஷர் யூஸ் பண்ணோம்னா, when we try to maintain the high pressure for the right lung, the left lung will get damaged. To save the left lung, if we reduce the pressure, the right lung will not work efficiently. So we isolated both the lungs, and we ventilated separately both the lungs using 2 different ventilators with 2 different settings. And he made a very remarkable improvement, and the infection which I think is the primary cause, we were able to control it. And after a 48 hours stormy period, we were able to change to a single lumen, reassess him, and we were able to remove the tube. We had the ICD for 2 more days, and slowly the whole lung expanded, the infections were controlled, and the ICD is removed, and today I'm hopefully expecting to discharge him from the hospital.
Great job, great work by the team. They worked day in and day out. Raja sir, he did not, I guess, go to the house and sleep for maybe the first 2 or 3 days. He was always present here.
Now this helped me get out of the emergency room and go into the ICU. After 3 to 4 days of rehabilitation, as you can see, I am fully fit. I can go back to my normal job and resume the duties that I am supposed to take up.
I am thankful to Dr. Geeta Haripriya to provide us with such a great setup here. It's a world-class setup. The team is good. They have been taking care of my brother 24/7, and today my brother is going to get discharged.
I really thank all the doctors in Prashanth, and really hope that they continue to do the great and noble work that they offer to the patients. I am really grateful because they practically saved my life and brought me back to the stage where I am functioning again.